A quick note before today's episode. While I'm a professor of nursing at the University of Minnesota, this podcast, Midlife Unmasked, is a personal project and separate from my professional responsibilities at the university. This podcast is intended for informational and educational purposes only and should not be considered professional medical advice. Please consult your own healthcare provider before making any decisions related to your health and wellness. In keeping with my role as a nurse researcher and educator, I'm here to bring evidence-based information to improve overall health and well-being. It is my goal to be a trusted source of information and to build this community where we can all learn, grow, and share together. With that said, let's jump into today's conversation. Hey Midlifers, welcome to the Midlife Unmasked podcast. I'm your host, Robin Austin, a nurse researcher and educator, and your guide to navigating everything from healthy aging and wellness to big stuff like caring for aging parents, mastering work-life balance, and discovering your next great adventure. So are you ready? Let's do this. Hey Midlifers, welcome to the episode today. Today we're talking about unmasking midlife sexual health and well-being with Dr. Kristen Mark. Dr. Mark is a sex and relationship researcher and educator. She's the current Jocelyn Elders Endowed Chair for Sexual Health Education and a professor in family medicine and community health at the Eli Coleman Institute for Sexual and Gender Health. Her research program centers around sexual well-being, specifically the maintenance of sexual and relationship satisfaction and sexual desire in long-term relationships. Dr. Mark is committed to community advocacy for inclusive, comprehensive sexual health education and currently works to change sex education policy at the state and national levels. Dr. Mark holds degrees in psychology, family science, biostatistics, and public health, and her research and therapeutic approaches are as interdisciplinary as her training. Today, also, Dr. Mark is currently relied upon as a national expert to digest sex and relationship science. We are excited to have her today and welcome her to the show. Let's jump right in.
Welcome. Thank you so much for joining us today. I'm thrilled that you are here, and our episode is Unmasking Midlife Sexual Health and Well-Being with Dr. Kristen Mark. We are so thrilled you're here. Again, thank you again for taking the time. If you could just do a brief synopsis about your background and what led you here to today, and then we'll jump right into the conversation.
Yeah, sure. Thanks for having me. So my background is really interdisciplinary. I come from mix of kind of psychology, public health, family science. I'm a sex and relationships researcher, educator, and therapist. So I get to wear a lot of different hats, which is great. And I'm the director of the Center for Women's Health Research at University of Minnesota, and also the director of education at the Eli Coleman Institute for Sexual and Gender Health, which is in family medicine and community health. In that role, I do a lot of education coordination of like what our medical students learn, for example. But I also do a lot of research in the area of sexual health. And my research program is mostly centered around maintaining sexual desire, satisfaction, pleasure across the lifespan, and particularly into long-term relationships and later in life.
That's great. Thank you so much again for taking the time to be here with our audience today. One of the first questions I want to dive into really is related to like desire and long-term relationships. In midlife, we all face various challenges that could be professionally, personally, and you've studied sexual desire and satisfaction within your research. And so how do couples sustain or maybe rekindle intimacy? And especially when we're going through major transitions, either caregiving, young kids, older adults, family members, menopause, even career shifts.
Yeah, I think it's difficult. And that's why it becomes like such a problem. It's honestly probably one of the most common questions that I get from like people in the wild that I run into who know what I do. And that's because it's really relevant to a lot of people's lives. And there's also like not a lot of openness to like talking about sex in general. And so therefore it can be really hard to navigate that topic with your partner and to navigate finding solutions. The solutions to that and like ways to kind of mitigate that decrease in desire over time or the decrease in satisfaction, there's a lot of different strategies that can be used. But what we find overall is that when you work together and when you sort of don't see it as like one person's problem in the relationship, but rather it's like a we issue, then that really helps with navigating these issues and with being able to more successfully find a path forward. And the other thing I'll say is one of the solutions is like, you actually do need to prioritize it and acknowledge that sometimes you're not going to be able to, and that's okay. Like that is just something that you need to talk about with your partner and say like, this particular transition is really difficult, or this particular transition, we might look different on the other side of this, and our sex life might look different on the other side of this. And like, that's okay. I think having this kind of like growth mindset towards sex goes a really long way in protecting relationships against sexual health being one of the issues that contributes to decline in those relationships.
Yeah. And I think it's too the expectation that it's always going to be a specific way, or like what we read in a book or the fairy tale that you may see in a movie, and the real life sets in. And so how do you manage all those expectations as well, especially during times of stress? I mean, that's big part of it. Yeah. That's great points. And so you kind of talked about that it's not always talked about, which is very, very true. And so it's kind of that breaking the silence. And so many midlife women also grow up with limited or inadequate sex education. And then in media still, or I think in general society, doesn't really want us to talk about it in a healthy, respectful manner at times. So how does early messaging around sexual health and what I think of my life as a Gen Xer grew up with, and what has it done to really reframe some of these narratives?
Yeah, I mean, I think that a lot of these conversations around sex tend to sort of just be discouraged over time. And that can result in feelings of shame around sexuality. It can result in feelings of like, this isn't very important. Like, I think that also gets labeled, even though the research very clearly shows that sexual well-being is directly tied to overall well-being. So it is an incredibly important part of someone's overall health. And if we ignore sexual health in the context of our lives, then the implications of the negative consequences, if you're not taking care of your sexual health, are incredibly important for your overall life and overall health. And so I think that sometimes that gets forgotten because of it being difficult to talk about. For some people, it's like a matter of learning the tools of how to actually say the words. Like there are people who have difficulty even just saying the word sex, or like that gives them like they get flushed in just like thinking about that, about saying that out loud, or like about asking their doctor about it, or about talking to their partner about it. And what I will say in those cases is like, practice in a mirror, practice that conversation.
Yeah.
And we have a lot of technology at our fingertips now that you can use to more softly bring up that topic. If it's something that you want to bring up with someone who's close to you, it's something that you can, send them a text message or an email, or that allows you a little bit of a buffer for like preparing for the kind of reaction that you might get, and for also making sure that your words are because I think when we get nervous talking about something, we sometimes don't say what we actually mean to say. Yeah. And so that can help with mitigating some of the nerves around that sort of thing.
That's really good advice, is to put it in, just write it down. Like, then it can help you to kind of think through even what you're even trying to express, and maybe you need to revise it, or it's a way to, and the buffer, I think, can help individuals as well to actually try to say what they wouldn't want to say out loud at that time. So that's really, really good. It's a great advice, I think, all the way around, because I think it helps to, internalize or really understand what you're even trying to say to get the message out. So I really like that a lot. And the other part I would like to talk about too is, I think there's so much kind of wrapped up with not only not wanting to talk about it, potentially shame, or not understanding and didn't having great education from up front, but then even the mental health aspect of it. I think there's such a psychological overlay with a lot of this. And so sexual function and satisfaction is deeply rooted, I think, and connected to, as you know, mental health and our psychological well-being and even self-image. And so specifically thinking of like advice that you would give women, how to feel maybe that they may feel disconnected. Maybe there was some past trauma that they haven't dealt with or are dealing with currently, struggling with shame, especially during this midlife transition. What advice would you give?
Yeah, I mean, I would say that as you're struggling through that, I mean, there are a lot of reasons that people struggle with this. And first of all, there is help available for that. And I think that it's not unusual to bring this up to a doctor. And I think some people sort of think like, oh, I'm not supposed to bring that up because of what we were talking about earlier with it being stigmatized. But there are tools available to help. There are like therapists who specialize in this sort of thing, like myself, who you can be referred to. And so I think like knowing that there are supports available is one thing. And then additionally, talking about it with people who you are close with or people who you trust is also important, not just with professionals, but also with your friends or with your partner, because you might be surprised to learn that like other people have also gone through this sort of thing. And we also know that like a lot of sexual function issues can be a combination of both psychologically rooted and physiologically rooted. And so you may well seek like physical care for the physiological piece and your issue is not resolved. That is very normal because it's complicated and there are multiple facets at play. In fact, the majority of the time, sexual function is more psychological. A lot of like what we'll do is we ask people to go and make sure that they get screened for like all of the possible physiological causes because it's so much easier to rule those out when coming up with a treatment plan for us to just say, okay, we know that it's not any of these things. So let's work on what's actually causing this issue for you. And let's like talk through some of that piece so that we can get a better handle on it. So talking about it, and I mean, that's hard because we just finished saying how hard it is to talk about. But I think once you do start, it does get easier with time to talk about these things. And when you bring it up to someone who you trust, I think also like letting them know, like, this is kind of nerve-wracking for me to bring up to you. And showing that vulnerable side of yourself that can actually fuel closeness in relationships.
Yeah. And that just another point, I think, too, as well as bringing it up. But also, I think I've talked to other women where they don't feel that they're being heard maybe by their current provider. And it's okay to go seek out someone else. It's okay to do that. And I think sometimes, trying to advocate for yourself already feels somewhat not normal, I would say. And so it's okay to, if you're not getting the answers from one provider, to go seek out somebody else. And you have to. I mean, I think that's just part of the steps. And I think it's, like you said, talking about it with a friend or getting a friend to go with you to the appointment or just sit in the waiting room with you while you go in or something like that. It's just, I think we're all in this together. And I think it's to have that supportive feeling. And then also, if you're not getting it somewhere, where do you seek out where you can go?
Right. And then I would also add that, we don't get a lot, as you said earlier, we don't get a lot of education about this. And so it's normal actually to not know a lot about it. And it's normal. And I think some people feel ashamed of that, or they feel like they should know more. And they should. It's true. We shouldn't be so disserviced that we have no sexual health information. And yet so many people are left with no information. And so I think no question is stupid or silly if it's sincere. So I think that if it's a sincere question, it is a serious question. And that is something just to remember, that you aren't the only one who doesn't know about this. And I think especially when it comes to midlife, like, women have been so historically excluded from research. And this issue in particular has been particularly, because of all the reasons that we've talked about, has been particularly ignored. And so there are many providers out there who don't know a lot about this. And there may be many who don't feel comfortable talking about it. So if you can at least get the comfort box checked in your provider and have a provider who's comfortable talking about it, they at least know where to send you to get more information, or they know how to look up that information so that they can be a better care provider for you. And if you don't have someone who's doing that, then I think it's time to kind of look at what's another provider that I can go to who is open to talking about this, because we don't have all the answers in the literature for how to manage sexual health in midlife and beyond, but we're working on it. Like, for example, at the institute where I am, the Institute for Sexual and Gender Health, we just hired a brand new endowed professorship that's focused on sexuality and aging, because that area is so incredibly underserved. This was a really important position for us to funnel money into fueling the research in that area. And so, we have just recently extended an offer to someone I really hope they accept. And
that's great.
I think it's one step in the right direction of getting more information out there about this topic.
Being in the healthcare space, you think you know what you don't know, especially around midlife and aging and sexual health. And last year I attended the Menopause Society conference for the first time. And I learned so much just about hormonal changes and what it can do to so many aspects of your life that we've never really talked about, or I've never been exposed to. So that position that you just mentioned will be fabulous, I think, to have, and to be able to have that resource at the university is amazing. That's great. Kind of going on this topic of maybe potentially not getting the education. And then we all use Google. I use Google quite a bit to ask specific questions, or now AI or ChatGPT. But what are some persistent myths that you hear around midlife health and sexual desire? And one of them is that it fades over time, and that's natural. Your desire fades over time. But research shows that that's not the case, and that with the right conditions, the right environment, things like that, or the connections, that desire can really remain vibrant, throughout a lifespan. So what strategies can partners help to navigate some of these myths and maybe that feeling of disconnection that you'd recommend?
Yeah. So I think with the desire issue, certainly with the right conditions, desire can remain strong over time. And I also think that our understanding of desire needs to shift with time too. And so I think so many people think of sexual desire as this like urge, this like strong drive of like, I must have you now, and just like that feeling that you get early on in a relationship, for example, when like you can't get enough of each other. And it's really, really normal for that to fade over time. That is not, you should not have the expectation that that is going to remain, especially as you're tackling like all of life's other demands, that type of desire is going to remain. We call that type of desire spontaneous desire. And what will remain is, and can remain, not always. I mean, some people do struggle with sexual desire issues, a lot of people actually, but often what we see is that it's just a misunderstanding of why the desire is low. So for example, there's this other type of desire called responsive desire, which may come after the experience of something like arousal, right? Like you may need to get aroused first and decide and make like a cognitive decision, like, I want to engage in sex with this person because I know that the benefits outweigh the drawbacks. And I know that afterwards, I'm going to be happy that I did because I'll feel more connected. I'll feel more seen. I'll feel the benefits of pleasure, all of those things, right? That's called responsive desire when like it's not a matter of you like driving toward it or like really wanting it. It's like, and that is what we maybe have to rely on a little bit more as we enter longer term relationships and over time with age and with aging, with some of the physiological aspects of aging that might negatively impact our sexual function. But also there's, in terms of like desire and trying to maintain that over time, I think the benefit is that we can mitigate those issues around sexual desire by ensuring that the other pieces, you aren't experiencing pleasure during sex. That's a very normal condition that you would not experience sexual desire. Like we would expect you to not experience sexual desire if the sex doesn't feel very good. And so that's not a desire issue. That's actually a condition issue and a context issue that needs to be addressed instead of the desire itself. So those types of things, I think getting really clear on like what is the issue here, and then also acknowledging that there are physiological changes that happen that do decrease the experience of pleasure and lubrication and arousal and can cause things like pain. But there are ways to navigate that where it doesn't like if I hear anyone suggest have a glass of wine one more time, I mean, that is absolutely not an acceptable solution to this very real problem that people are experiencing. And there are some solutions available to those issues that involve a whole host of different types of approaches. They're not pharmacological necessarily. And then I would also say that the relationship matters a lot. And so we know from a lot of research, some of my own included, that relationship satisfaction and sexual satisfaction are incredibly intertwined and they are bidirectional. So they both influence one another. And so if you're having difficulties in your relationship or there's some sort of a relational stressor, to expect that your sexual satisfaction will remain or to expect that you're going to desire sex is an unrealistic expectation. Because again, it comes back to that context and those conditions within which the desire exists.
That's such good, I think, advice to put things into perspective and that there's, to really try to, I think, tease out the issue. Is it the desire issue, more of a physiological issue? Is it both? On top of that, there's a relationship to be a bi-directional relationship. And so I think a lot of times women, we take it on ourselves that we have to solve it by ourselves. Quietly, silently, which only adds, I think, to more stress and more buildup and more tension and more anxiety around the whole issue. And so this is such great advice, I think, to one, bring awareness to it is the first step, and then two, being able to then talk about it and then try to find a trusted person to really bring this up and to explore it more. And I think it's okay to be able to do that. So this is such great advice as well. I thank you. Yeah. So the other thing I want to kind of touch on, and before we were, I think, recording, we talked a little bit about the funding and some of these other potential policy changes. But So in your work as well, I know you do a lot of advocacy. And so we've been active in kind of the specific sexual health education policy advocacy work. And so what shifts do you see through what's happening right now, maybe through policy and or even media, how this is influencing things? Do you hope to see in the coming years that would be better supporting women through sexual health and also relationships across the lifespan?
Yeah, I mean, I hope in coming years there's more support for that. Certainly right now, it's a challenging environment. Women's autonomy, bodily autonomy is being attacked. And, there's a lot of things going on related to transgender healthcare that also very much impact menopausal care. It's amazing the overlap there. And I feel like that has not received enough attention. And I think not that necessarily that would, that given how women are viewed, wouldn't necessarily help the cause, but unfortunately, but I think, there's one of the things that is problematic in terms of where people get their information is that people are often getting their information online, and even on like platforms like Instagram or TikTok. Like there's a lot of people who are on there trying to say things about sexual health. Some of it is accurate, some of it is not. But regardless, even people who are providing accurate information, like accurate sex ed, and are trying to improve inclusive sex education and comprehensive sex ed across the lifespan, like this is not sex ed for like kids even, this is like for adults, they're facing issues with like, we can't even write the word sex or else we get shadow banned. So that is a real challenge, and it results in people not getting information that they certainly deserve. And I don't necessarily see a path forward where that's going to improve anytime really soon. And even in the future, I don't know. It comes under this guise of like protecting children from being able to kind of see sex represented in the media, but they can access pornography more easily than they can access accurate sex ed information. And that becomes a bit of a problem. And so I think that, or it at least points out where the actual concern lies. And so, yeah, these are all issues that we struggle with and we're dealing with. We run a sexual and gender health clinic, and that's obviously also challenging right now in this landscape. Our research program, we've dealt with NIH cancellations and all of those issues that many other scientists are dealing with as well. It's not good.
Yeah. I'm sorry to hear that too about the cancellation. It's heartbreaking right now, I think, and trying to get your grasp on it. And so I have good days and bad days. Like I'm like, it'll be fine. We'll be fine. Then it's like, no, we're not fine. This is not going to be good. This is going to, I think it just will impact women and children and minority and marginalized groups for generations to come. And it's so disheartening at this point in time. So, yeah.
Yeah, I think that's the part that's hard, right? Is that these changes are impacting for years to come. So, I think that even if these changes aren't permanent, they are going to take a lot to reverse. And so when we look at sex ed policy, for example, it's very difficult to advocate for sex ed policy across the board. I do a study abroad program in the Netherlands where they have federally mandated sex education that's comprehensive and inclusive from preschool onward. And for us to get something like that here, because every single school, for example, is governed by a separate board, a school-based decision-making board, you can have a kid in one school that's less than a mile from another school getting vastly different information. And so we don't have any sort of standards, even at the county level, let alone the state level, let alone the federal level. Federal level will never happen in this country. State level is very difficult to come by. And even if we could get county level, it's just so hard to really get that to move forward. So we need to look for other ways. And I think that those other ways include things like finding websites that are very reliable, I'm part of the creation of this initiative called the Talk Toolbox, where it's like a box delivered to your house for kids at various different ages. And it provides like sex ed interactive materials because parents also don't really know the answer to some of these things. And then for midlife and beyond, like, I don't know, I feel like one of the places to reach people is social media, but then I just talked about that issue with being able to get accurate information. So it's really, you have to do a lot of work. You have to do a lot of legwork on your own to really make sure that you are following people who are providing accurate information. And then maybe but you won't be able to find it organically as easily as we used to be able to.
Exactly. And even sometimes my go-tos are always like, look for websites that are .gov or a .edu, and now I'm like, I don't know if they're even existing anymore. And some things have gone away as well. So it's not easy to find the information. I would agree with you 100%. And so that's part of the issue. But I think it's, again, reaching out to making sure you're with your friends or providers and people that you trust is even more so important now, I think, even than maybe a year ago, potentially, which is so sad.
Listening, like this podcast is a good example of trying to get more accurate information out there. I run a series called Sex Science Happy Hour. It's only in person, so it's for people in the Twin Cities, but that's another way that that's the purpose of that, is to disseminate sex science to the public that's accurate and answer questions that people have. Yeah, I think that there are there are certainly things going on that are trying to fill this gap, and yet it's sort of hard to figure out where they are without sort of word of mouth.
Exactly. I love that you do that, the Sex Science Happy Hour. That's fantastic. And for those that might not be in the Twin Cities, I would say try to find your local university if there's other researchers out there doing this kind of work, I think, or providers that may be doing something similar. It's another way to keep getting information. So that's great.
Yeah. I try and keep up. I try and do a TikTok and a Instagram, but it's so, I don't know anything about social media stuff. And so I feel like I certainly know how to disseminate science, and I'm doing that.
Yes.
But in terms of gaining followers or figuring out how to do the social media system, I don't know how to do any of that. And so, I just don't. But I think finding people, most of the people delivering accurate information are like that. They don't really know the social media side.
Right.
So I do think that I look for people who are actually academics or who are actually doing research, then you'll be in better hands, I think.
I know this is the social media portion. It's totally new, but it certainly adds a whole nother element to our work as far as dissemination of, as you know, we go to conferences or maybe publish a paper, but then it doesn't go beyond that. And so this certainly does offer us another opportunity to disseminate to the public as well. So no, that's great. I guess one of the last questions that I like to ask is, what is one piece of advice, or more, you don't have to choose one, that you give every woman entering her 40s and 50s to prepare for a vibrant and empowered life?
Yeah, I think, one of the things, a piece of research that I really love is around orgasm and how orgasm actually gets more pleasurable with age for women. And it might not be more frequent, and it might not result in more desire or whatever, but certainly it results in more pleasure. And I think that one of the reasons for that is that people become more comfortable with their bodies. They become more, even though there might be a lot of bodily changes happening that are making you feel like your body is not true of your own sex life, with yourself in your own practices, but also with partners. It's really beneficial to kind of be open to the script changing. And that will allow for being malleable to these changes that are happening, and also being open to variety, and that even just your definition of what sex is. I think being open to that changing over time is really protective against any sort of decline in your sexual health through these years in particular.
That's great advice. Yeah. Your advice earlier too about changing your expectations, I think, and really revising what that script says in your head of what things possibly should be. I think it's such great advice too. And you don't have to take it on yourself. That's the other piece.
Right. Yeah. And certainly our research very clearly shows if you have these issues, you don't need to take it on yourself. You don't need to hold it and think that it's your thing that you need to fix, which is so often where we go automatically is it's all right. I got this. I'll do this. I'll figure it out. That actually is not helpful for sexual issues. It's way more helpful to talk to your partner about it, as hard as that might feel like it is, and come up with a way that the two of you can see this issue as a we issue instead of a me issue. Because when you make that shift, you're going to see improvements in your sex life that are far more impactful and longer lasting than anything that you can do just on your own.
That's great advice. Yeah, it's a we issue. I'd like that a lot. That's great.
Yeah.
Well, thank you again for this conversation today. I so appreciate your insights and expertise. I think we can probably talk for hours and hours, but this is such great, I think, insight in for women who are struggling in this area, that it's okay to talk about it, and trying to normalize these conversations as best we can will benefit everybody. So thank you again for your expertise.
Yeah, thank you for having me. I appreciate it.
That's a wrap on this episode of Midlife Unmasked. I hope you found inspiration and a few key takeaways. If today's episode resonated with you, please be sure to share it with someone else that could also benefit. And don't forget, this podcast is here for you. If you have a topic or a question you'd like us to explore, please send it our way. Your feedback helps us reach even more listeners on this shared journey. You can find us on social media and our website, midlife-unmasked.com. That's midlife-unmasked.com. And the links are also in our show notes. Until next time, keep unmasking your potential, embracing the possibilities, and living your best midlife with courage and confidence. Take care and see you next week.